Now moving towards the mechanism, how antibiotics resistance in biofilms developed. Number one, let's start it. Bismillahirrahmanirrahim. Sometimes when antimicrobial agents or antibiotics has a limited diffusion, so it does not reach the biofilms. So at sufficiently high levels during a given time of exposure. Even if you even give a sufficiently high levels of antibiotic, it does not reach at that moment of exposure. It does not reach, so it has a limited diffusion. Number two, when there is unequal distribution of electrical charge within a biofilm, when the charge develops, so intrusion may be further complicated, means penetration of that instrumentation or antibiotics is further being complicated in those areas. So depending on biofilm charge that on the charge of penetrating molecule. So biofilm, so the areas of biofilm that depend on the charge of the penetrating molecule, that on certain areas of the biofilm when there is a charge, so those medications cannot penetrate. So very important, unequal distribution of electrical charge. Okay, then when there is availability of nutrients in within a biofilm, so there is a reduce in their metabolism, so less susceptible to the killing by the agents which is interfering with their protein either or DNA or cell wall synthesis, so may reduce their metabolism. Okay, so bacteria may also reduce their metabolism. If they reduce their metabolism, so the medication will not enter in them. So number one, it was that limited diffusion. Number two, you have that there was an unequal distribution of the electrical charge. Okay, and also the metabolism. Okay, so there was a reduce their metabolism. In vitro studies, it indicates that the attachment bacteria to the surfaces can trigger the genes. So, according to the vitro studies, it indicates that the bacteria attachment to the surface can trigger genes, which activate the specific resistance mechanisms, and these mechanisms are switched to upon by contact, and they can occur already uniformly in every thin biofilms. So they say when the genes are triggered in the bacteria, so they activate their some resistance mechanisms, and due to that mechanism, when they are in active form, so what they do, they form a new biofilm, and due to the formation of a new thin biofilms on an old biofilm, so the penetration can become more hard. So number one, there was a limited diffusion. Number two, there was reduced metabolism, then the triggering of the genes, and number fourth, it was the when there is an unequal distribution of electrical charge. Okay, now antibiotics that is used in the treatment used to treat the periodontal diseases. What antibiotics we use? It is basically penicillin. In penicillin, the most famous is amoxicillin or augmentin. Penicillin has a very extensive, you can say, broad antimicrobial agent. Okay, excellent absorptions used systematically. Amectin, which is a penicillin, penicillinase producing microorganisms used it systematically. Okay, okay, then when you can give it, localized aggressive periodontitis, generalized aggressive periodontitis in both. Then medically related periodontitis means immunocompromised patients which has a periodontitis, and refractory periodontitis when you have. Okay, so in this both you can give LGM, you can learn by this, and R. Tetracyclines, two you use minocycline, doxycycline, and tetracycline. Minocycline has a very broad spectrum, so it can be systematically and as well as locally used. Doxycycline as above, and tetracycline, you know it, it is basically a submicrobial dose for host modulation. So it is effective against, it has also a broad spectrum. Okay. Then quinolone, cephaloxacin, you know it is a gram negative promoter. And health associated macrolides you have azithromycin, which is concise with the inflammation and used systematically. Lincomycin derivatives you have clindamycin, which those patients which are allergic to the penicillin, you can give this. It is anaerobic bacteria, you can use systematically. Nitronidazole you have metronidazole, which is also anaerobic bacteria. Both orally and locally you both can give. Indications that you have lap, gap, mrp and rap and necrotizing ulcerative gingivitis, means you have localized aggressive periodontitis. Then you have generalized aggressive periodontitis. Then you have actually refractory periodontitis. Then you have medically irritative periodontitis, and also necrotizing ulcerative periodontitis when you have. Okay.